Inflammation is a common symptom that we see in patients with chronic Lyme disease. Inflammation, depending on where it occurs in the body, will cause many different symptoms. One of the tricky things that we do find, though, is that because inflammation is such a common thing, it's hard to tell sometimes if someone's chronic symptoms are coming strictly from inflammation, or whether it's coming from chronic ongoing infection, or whether it's kind of a crossover of both of those things. And my personal opinion is that it's probably the latter, and that we probably are seeing chronic infection and inflammation at the same time. But I do think that there are some cases where inflammation is actually more of our issue that we need to deal with. One of the patients that I've been seeing has a case that follows this pattern, and I wanted to just share a little bit about that with you. So I first saw this patient in early 2022, so about a year and a half ago. Prior to seeing this patient, he had contracted Lyme disease in 2019. And it started early in the summer, and symptoms were described as a summer flu, but wasn't actually diagnosed with Lyme disease till the fall of that year. He was then put on a 28-day course of doxycycline, during which that time felt completely better, 100%. Shortly after coming off the medication, within several weeks, all the symptoms returned. In the year 2020, he went through 2 more rounds of those doxycycline treatments, 28 days each, and with each of those treatments, again, felt great, felt 100%, and with each of those treatments, shortly after quitting the treatment, he would relapse. He would have symptoms return again. Eventually, he was sent to infectious disease, who thought, this isn't even related to Lyme disease. You're probably just getting an anti-inflammatory effect from the doxycycline. Now, I definitely don't agree with that assessment. This guy definitely had Lyme disease. He definitely had a positive test. He had the deer tick bite. He had everything that goes along with it. And when I saw this patient, it had been a couple of years of doctoring and trying to figure out what's going on, if this isn't Lyme disease, and what else is this? Without finding the answers that were sufficient and giving him what he needed to get through and to feel better, he came to me, and we treated this as a case of chronic Lyme disease. So we restarted treatment. And at that time, I started with doxycycline along with ceftonir. I did a combination of antibiotics for a while. It actually took probably 3 to 4 months before we got to a point where he was feeling 80-90%. And after about 6 months, was starting to really feel well. Not 100%, but a good 90-95% on most days. One of the theories in chronic Lyme disease is that there can be persistent infection. This is something that we know is true. And so one of my thoughts with this patient is that perhaps that's what we're dealing with, and perhaps that's why every time we quit the doxycycline or quit the treatment, we're having these relapse of symptoms, because the persistent bacteria just keep coming back and causing problems. So we switched over to a persister treatment, and specifically in this case, we used disulfiram. And I've used disulfiram with a number of different patients, and some of them have done fantastic with it. And in this case, we just didn't really have a response to it. Every time he went off the doxycycline, he still felt worse. And so we ended up doing the doxycycline along with disulfiram to hopefully keep him feeling well and allow the disulfiram to do some more work for him. And we ended up having to stop disulfiram just because of side effects and just didn't tolerate it the greatest. And so over the course of time, we kind of came back to that thought process of, is this still chronic infection, or is it more inflammation? So we decided to make a change. And what we did is we slowly weaned off of doxycycline, all the while slowly titrating up on low-dose naltrexone, which is a great treatment for chronic inflammation. It's a very safe medication that doesn't have very many, if any, side effects for most patients. And so it can be taken for quite a long time if need be. So as we started tapering off the doxycycline and titrating up on the low-dose naltrexone, what we found is that symptoms remained stable, meaning that he was doing well. He still had that 95% improvement and felt that well consistently. The last time I saw this patient had been about 2.5 months off of the doxycycline, and we are now up to 6.5 milligrams of low-dose naltrexone daily. And at the point where I saw him last, about a month and a half ago, things were going really well, and we were continuing to hold steady. Now, I'm going to be following up with this patient in the near future, and hopefully can give you an update on how we're doing here. But I really think that in this case, it's very likely that this chronic inflammation is one of the reasons why we just aren't getting better, because there can be these chronic effects. Autoimmune inflammation, much like long COVID, can cause chronic symptoms even if the infection is gone. Lyme disease can do the same. And so I think it's super important to make sure that we're diligent in killing infection, and certainly if we have chronic symptoms, there's definitely cases that require longer term treatment to get longer term results. But something to always be thinking about is there inflammation that we need to be addressing on top of this? And if that's something that is going on and it's not being addressed, there's a good chance that we're not going to have a resolution of symptoms.